Hello and welcome once again to this session where I'm still continuing with the introduction to pathology and what pathology is all about in this part 2. So let us continue to follow statement by statement, and we keep on also grasping this knowledge so that in the near future you make an informed decision. Then also, when it comes also to the perception, I want all of you to keep and erase the other negative perceptions that you have, that the pathology is all about doing the postmortems or autopsies. But anyway, all in all, doing autopsies is also important because it is in this part that you are yet to know. Also, you are going to know to understand the importance and the use of doing autopsies or postmortems. Therefore, at this juncture, allow me to start sharing my story once again. Yeah, so the part one stopped, of course, abruptly because of technology hiccups. It stopped abruptly when we had reached the point, the branch of genetics. It stopped abruptly, and I was saying that when it comes to genetic counseling, before you actually commit, before you start producing children, dear ladies and gentlemen, as a couple, don't only be selfish, don't be selfish and you only concentrate on your love affairs, and you don't focus on also the future of the children that you are going to produce, whom you are going to produce, or whom you are planning to produce. Look, sickle cell disease is a disease that disturbs very many families. And if you make a decision and you start producing, remember, if you are a husband and you're a carrier and the wife is a carrier, the chances of producing children with the sickle cell disease is higher, becomes, of course, 25%. Don't call it a small percentage. Don't call it a small probability. That is a high probability, brothers and sisters. Therefore, it should before even know your blood groups, before you know your HIV status and the hepatitis B and other infectious diseases, you should always actually think about this genetics, these genes that we carry. If you need to know if you're a carrier, of sickle cell disease gene, you need to know so that you don't only be selfish and for you are in love, and then you start producing children who will be suffering unnecessarily. So the best mechanism to prevent this actually such occurrences is to go for genetic counseling. I mean, to go for genetic screening for common diseases which disturb actually people, impoverish them like that. So genetics, we look at genetic diseases in details as also in as far as branches of pathology are concerned. So now, pathology generally is divided into two branches. Pathology is divided into two branches, of course, two categories. We have what we call general pathology and systemic pathology, like you saw. General pathology, these are the chapters that you study in the discipline that introduce you to understanding pathology, to know what pathology is all about. Then, by understanding the chapters that are covered under general pathology, it's there you are able. This is the chapter or the sub-chapter that ushers you into another big chapter called the systemic pathology, whereby you understand things from the first principles. It is from here you are introduced to general pathology. We are here to know what happens in general pathology. For example, this is the real introduction to pathology. It marks the beginning of pathology. The language of pathology is introduced in details at this point. Basic definitions, and after everything begins, and after knowing the basic definitions, the language of pathology, basic language, you are able to now start going into things or subtopics which are covered under general pathology. From the cell, of course, here we begin from the cell to the tissues, and finally to this broad chapter leads us to understanding of systemic pathology. What is in systemic pathology? In systemic pathology, for example, you look at the respiratory system, you look at the cardiovascular system, in the gastrointestinal tract or gastrointestinal system, genitourinary system, and you look at a system, we get a system like gastrointestinal tract or gastrointestinal system, you look at all the diseases, grossly, of course, anatomically, grossly, the morphology, and also up to the histopathology level, up to the immunohistochemical level, to know whether it is a cancer, which type, if it is a cancer of the gastrointestinal tract, or a cancer of the colon, which type is it, which subtype is it, which immunological molecules does that cancer express, what makes it actually more aggressive, what makes it more unique from others, like that. Why is it that for it, if it is breast cancer, triple negative, why is it that, okay, I don't want to mention those things. That is the information which you know when you reach there. When you are looking at breast cancer, why is it that this one is resistant to chemotherapy and this one responds? All those things. So that is a systemic pathology. If you are looking at the eye, you look at diseases of the eyeball, how they come about under the microscope, which is histopathology. Or how does it look? How do tissues look like? If someone died of COVID-19, of course, you get the lung histologic sections from the lung of a COVID person, of a COVID victim. How do those under histopathology, under histologic sections, how does a COVID lung look like? You see all those tissue blocks. How does an abnormal prostate look like under the microscope, under histopathology? Then under immunohistochemistry, how does it look like? If it is a fine needle aspiration cytology, aspirate or biopsy, which is FNAC on the biopsy or from the breast, how does the cytology of the breast look like from an abnormal region? Under the microscope, under immunohistochemistry, all those things. And of course, even genetic sequencing, when you do genetic sequencing from those abnormalities, which genes, which genetic abnormalities or mutations are you going to see? So just to know that everything is interesting and everything is covered in details here. But is this general pathology that ushers us into systemic pathology? Like, for example, we, the Christians who believe in the Holy Trinity, God the Father, the Son, and the Holy Spirit, we said for you to reach God the Father, you must pass through Jesus Christ, the only begotten Son, who is a Redeemer. But before also you reach Jesus Christ, you must be sanctified. Who is responsible in the Holy Trinity? God the Father, the Son, and the Holy Spirit. Who sanctifies us? It is the Holy Spirit who purifies us, or who that sanctifies us. So you must be sanctified. You must be purified by the Holy Spirit. Then you are able to pass through Jesus Christ to reach God the Father, who is the Father, the omnipresent, the omniscient, and the omnipotent. Likewise, to understand also diseases in as far as pathos is concerned, pathology is concerned, you must first understand, of course, the first semester of second year, medicine and surgery, dental surgery, Bachelor of Science Nursing, and Bachelor of Pharmacy. In second year, you must first appreciate general pathology in order for you to flow smoothly in systemic pathology. So from the cell to the tissues and finally this broad chapter leads us to understanding of systemic pathology. So The following are the topics that are covered in this chapter. We look at here. We look at cellular responses to stress and toxic insults. You look at how the cells behave and how they look like, how they behave when they have been injured, when they have been exposed to toxic insults, stress, injuries like that. You know, when for example, and when you look at a wound, it means when you look at an open wound, or even if it's a closed wound or an ulcer, it means millions and billions of cells were first destroyed to cause the wound, which means a certain portion of the tissue got damaged first in order for the wound or an ulcer to occur. Are we together? So it means when you destroy massive cells, millions of cells or several hundreds of cells, you are going to cause a wound. So a wound, what causes a wound? There can be maybe chemicals, maybe fire, maybe just injury and abrasion. You see shading off, forcing very many cells to get shed off, to expose the cells which should not be exposed. And that is the wound results. You see? So you look at cellular responses to stress and toxic insults. Of course, even if microorganisms cause toxic insults to the cells, poisons, drugs themselves, fire, of course, physical things like fire, dry heat, hot water, of course, causing scarads, you see. Then we cover acute and chronic inflammation. For us to understand diseases, any disease begins from inflammation, be it infectious, be it burns, be it any injury, be it anything to do with the trauma, any poison will trigger inflammation. Of course, it begins with acute inflammation, then when it persists, when it is not corrected, when it persists and is failure to heal, it progresses to chronic inflammation. And all diseases, from infectious agents, from non-infectious agents to autoimmune diseases, all of them start from acute inflammation, then eventually to chronic inflammation. This is all about immune system. You cannot understand inflammation when you do not understand the immune system, the basics or the normal information about the immune system. You cannot understand the immune system, for example. For example, I know that you have the hallmarks of inflammation. We have heat. Of course, they are derived from Latin. We have dolor. Of course, we have pain. Among the characteristics of hallmarks or characteristics of inflammation, we have pain. Pain, the study of pain is called, in Latin, it is dolor. Dolor. Like sorrow, from sorrow in French. For those of you study French, you know, for example, say sorrow is doler. Yeah? Doler. That is sorrow, being sorrowful, being in sorrow. That is dorer. Yeah? Being in sorrow. Then doror in Latin. Doror means pain. So dororimetry is the study of pain. You see, pain is one of the characteristics of inflammation. Then you have swelling. Swelling, which is a tumor. Tumor, that is in Latin is a swelling. Of course, that is the beginning of the tumors, introduction to the tumors, new growth, neoplasia, like that. Tumor, but not all tumors are solid or swellings, you know. So tumor, swelling, that is Latin. It is also another hallmark of inflammation. Then you have reddening, which is rubor. Reddening, rubor. Then you have heat, temperature change, fever, which is calor, the study of calor in physics, O-level physics, calorimetry, study of temperature change, calorimetry, calor, temperature, high-grade fever, low-grade fever, okay, fever. So fever is also a hallmark of inflammation. Then we have loss of function, function lesser, that is in Latin, from Latin, loss of function. For example, if I have a fracture of my tibia, don't expect me to walk. I'll first lose the function. I'll not use that limb for God's sake, until I recover. After recovery, that's when I will regain my function. That's when I'll be able to use that limb again to step properly without any pain, you see? So for us to understand any disease process, we must also appreciate acute and chronic inflammation, events, a series of events that occur in each of them. So another sub-chapter that is covered under general pathology, look at tissue renewal, regeneration and repair. This is where we look at how scars form, how scars come about, how tissues die, how organ damage keeps on occurring, be it lungs, maybe in asthma, maybe in chronic obstructive pulmonary disease, COPD, if it is chronic kidney disease. It is through this sub-chapter that we're able to know how kidney damage occurs, how in chronic hypertension, in diabetes mellitus, how hypertensive heart disease comes about, how the heart failure comes about in poorly managed or poorly controlled hypertension, how stroke comes about, all these things about how scars develop, how poor healing comes about, how fibrosis comes about in an organ. All this is, we're able to understand everything by appreciating this chapter called tissue renewal, regeneration, and repair. Then we have hemodynamic disorders. You cannot understand the shock. For example, shock, types of shock without especially, for example, hemorrhagic shock, without appreciating this subtopic or subchapter first, which is called hemodynamic disorders. Then you look at genetic disorders. Here we already have a clue. Because genetic disorders result into many diseases, very many diseases that haunt with the human beings and all the races. Anyway, there's no human race or tribe or ethnicity that is immune to genetic disorders. All these are disorders that are universal to the human race, the Homo sapiens, okay? Then we have diseases of the immune system. We also look at immunopathology in details, look at the diseases of the immune system in details. And all this under general pathology, as you can see. So we look at, then from there we look at neoplasia. Sorry, it is not neuroplasia, it is neoplasia. This error is not there. It is actually one. This one is not there, it is a mistake. It's an error, it is neoplasia. So, and it is one word, So neoplasia, neocolonialism, a new phase of, or a new wave of colonization in Africa. Neocolonialism in Africa. So new. Then plasia means a growth, new growth. So this is where this is the beginning. It is in this sub-chapter that you understand the hallmarks of cancer. How cancers come about, how carcinomas, how cancers come about, how new growth come about, whether benign or whether benign or malignant ones, whether non-cancerous or cancerous. This is this chapter where we start understanding how cancers come about, the triggers of cancers, the risk factors of cancers, and how they look like that, the language of cancer, general or oncology. This is where we start understanding the language from appreciating it in details, not just passing on the surface, but in details. For example, the molecular biology of cancer, looking at those genetic mutations, the environmental factors like that, the abnormal proteins that are expressed by tumors or the cancers and also normal tissues like that. So it is under neoplasia. Then we look at infectious diseases also under general pathology. Then from there, we look at environmental and nutritional diseases, malnutrition, the severe SAM, to the pediatricians, those in the pediatrics and children, some severe acute malnutrition, moderate acute malnutrition, and how to correct it like that. So in pathology, general pathology, also look at all those, how malnutrition damages the body, how it causes, of course, disease, how malnutrition, or even overnutrition anyway. Undernutrition and overnutrition, how they are, all those are under malnutrition. All those, how they contribute also, how they cause disease. For example, if you eat too much fatty diet, you know what will happen, of course. You put yourself at a risk of cardiovascular disease. Too much carbohydrates, of course, which are converted into energy, still living a sedentary lifestyle, you know how diseases will come about. Then also lack of certain nutrients, you know, they predispose us to diseases. So everything is covered in pathology. Then diseases of infants and childhood. That's where we look at also those other diseases that are common in children in a certain in the age bracket of children. You see, so eventually you are now ushered in. The moment you have covered those chapters, then now you start looking at every disease here in systemic pathology. Every disease, of course, for you to appreciate and understand it, you must have appreciated general pathology. So you get a smooth walk, a smooth run when you understood general pathology to understand dermatopathology. Diseases of all body systems are covered now here. You know, when you know what the meaning of neoplasia, because neoplasia is you are looking at tumors, new growth, cancers and non-cancerous tissues, how they come about, ulcers, for example, if you are looking at the gastrointestinal tract and particular to the stomach, or you are looking at the stomach, you are able to understand how ulcers comes about. Of course, there's inflammation. If it is stomach cancer, of course, there's neoplasia. Of course, it begins as a neoplastic growth, and something as neoplasia, then eventually stomach cancer. So it means if we are talking about cancers, there are cancers of the skin, which is dermatopathology. You study disease of the skin, both cancerous and non-cancerous, which is dermatopathology. Derma, the skin. Then pathology, you know. Neuro, the brain pathology. Neuropathology. Musculoskeletal pathology. Cardiovascular pathology. Respiratory system pathology. GIT pathology, that is gastrointestinal tract pathology, endocrine system pathology, reproductive system pathology, genitourinary system pathology, hematopathology, that's the disease of blood, like that. You see, now, so it doesn't mean inflammation occurs in every system that you are seeing here. And cancers occur, infectious diseases affect all these systems here. Malnutrition affects all these systems here. Fibrosis and tissue injuries occurs in all these systems here. That's why you must first understand general pathology before you go to systemic pathology. So now at this juncture, allow me to take you to the frequently asked questions, which are FAQs, facts. Common questions that we encounter as the residents, pathology trainees, or SHOs, and the pathologists who are already qualified. These are the common questions, and let me also respond to them. One, why do you do postmortems or autopsies when even the cause of death is obvious? Members, ladies and gentlemen, dear brothers and sisters, actually listen carefully here and pay attention to this question. There are so many reasons as why we do postmortems. You know, postmortems fall under forensic pathology. For example, people get involved in road traffic accidents or in aeroplanes, and again they are banned in buildings, and people are banned beyond recognition. So we are able to identify who the rightful owners of the bodies by doing actually karyotyping. We do DNA on those dead body on the bodies that have been banned beyond recognition, so that if family members, biological family members come and to claim for their bodies, we do DNA on them and we're able to hand the bodies to the people, to their rightful owners. You see? Yes, still on the issue of DNA, you know, we men, especially for us men, we say, you will say, but this child, madam, this child is not mine. I'm not the one who fathered this child. No, you are the one. Yeah, then eventually, let's go for and do DNA. We are the people who solve those puzzles. You see? But back to the postmortem. For example, there are very many reasons why we do postmortems. There are indications of doing autopsies or doing postmortems. For example, the general reasons we have cases selected for autopsy can include, but not limited to, for example, to number one, we do, for example, in the case of death in which the due cause is unknown or unanticipated. sudden death, we have to do a postmortem. Then death in which there are significant questions concerning effectiveness of therapy or the extent of disease. We are forced to do postmortems so that to know if the person, maybe if the treatment is done that led to the cause of death in the clinical setting. Death in which we do postmortems. In cases, of course, in death in which the family expresses concerns or requires reassurance. For example, someone might be working in a certain environment, and he maybe he has disagreements and maybe is not working in harmony with the peers and the colleagues at the workplace, and maybe he dies suddenly. And then you find that the family, his or her family comes saying that, you know what, we know our dear, we know our family, our person was poisoned. We had already told us that at the workplace, they were actually chanting him, they were chanting her. He was actually hated already, we knew. Therefore, we cannot accept this. We shall not accept the burial. We shall not simply bury the body of our dear one without doing a postmortem. And we must also look for our own. We need our own independent pathologists. We need an independent pathologist. We don't want the one whom maybe the company will give us. No, our member was poisoned by the colleagues. Eventually, of course, you have to go and do a postmortem. You have to do the postmortem to, of course, to reassure and also to confirm the doubts, to confirm, of course, the doubts, to confirm maybe the information which the family is saying, or to rule it out and you declare the other party innocent. Okay? And then also the death also, death when genetic diseases are suspected but not confirmed prior to the death. So in such, of course, in such conditions, when someone has died of a suspected genetic disease, we do postmortems and we preserve also those samples for future use, for future studies, for future references, and it also to write textbooks like that. Okay, members. We don't do postmortems of the whole. Very many people in various parts of the world, they know that postmortems are done because there are certain human organs that are used to make human medicines, like the brains. No. It is absolute no. It is an absolute no. No. There's no human medicine which is extracted from any human body tissue. Please, unless maybe organs for transplant, but still. At autopsy, you cannot, by the time you do the autopsy or the postmortem, all the organs are dead. They are dead, they have undergone ischemia, they can no longer function. Maybe the only organ that you can harvest at postmortem, depending on when the interval is still, when the postmortem interval is still short, less than maybe 3 hours, maybe the bone. The bone is the only maybe viable organ that you can use, that you can maybe harvest it from the body and you transplant it into another body. That is only the bone. But other tissues, honestly, there's no tissue which can, by the time a person dies, oh yes, organs, not all the organs die at the same time. Organs die, of course, the kidneys die among the organs which die early, the brain, the kidneys, the gastrointestinal tract, the skin follows, then muscles, of course, and the bones tend to die last. You see? They tend to die last. Now, when you start saying that they extract organs and they retain them to make medicines, by the way, I invite all of you to come and you see the science. If you are strong-hearted, you can come and you can always take a visit. You can always pay us visits and we teach you and we take you through and you see. There is no body organ which you can extract it from a dead body, from a dead body, and you transplant it and it is accepted. And the body of the recipient accepts it. By the time you do the postmortem, most organs are dead. Most organs are dead. First of all, you cannot get like the human brain and use it that you have to make drugs. First of all, they are what we call prion diseases. Prion diseases which are highly infectious and fatal. Now, how will you knock out those prion proteins from such a brain tissue in order for you to make the medicine? If you read about prion diseases, of course, in medicine is not studied from Google, but for just the scanned information, to get a tip of an iceberg, you can Google about prion diseases and you know how they come about. So you cannot play with the human brain that you want to make medicines from it or any other body organ. No. Very dangerous. So from today onwards, then there are also other reasons why we do, of course, postmortems. Death, for example, death which have occurred during diagnostic and therapeutic procedures, and maybe you are in the process, someone maybe is waiting for maybe radiotherapy, or someone is waiting for radiation, maybe for a CT scan, and maybe following the head injury in the road traffic accident, and the person dies. Still, you have to go ahead and do a postmortem, and you know which part of the brain got damaged, which consequences, which complications resulted from head injury and resulted into death. Was there maybe coning, which is maybe tonsil herniation or subpharisine herniation of the brain tissues, all those things. You see, whether was there cerebral hemorrhage or brain hemorrhage or bleeding in the brain? Was there a fracture of the skull like that? Was there a CSF autoria? You see, all those are the reasons to confirm, so that you know why we do, so that you understand the cause of death, the source of death. There's the immediate cause of death, intermediate, and also the final one. Okay, so of course, sudden, unexpected, or unexplained death in the hospital, which are apparently natural and not subject to forensic medical jurisdiction. All those death types of categories of death force us to do postmortems. Then also in the death of patients with medical condition on course that is of educational interest or value. For example, we have tissue blocks, for example, from COVID lungs. Patients who died of COVID, at least many postmortems with the time, of course, when WHO said, okay, you can now start. When the World Health Organization gave us a go-ahead, they said, okay, you can now start doing postmortems. We have now studied, to some extent, the coronavirus disease 2019, SARS-CoV. We have studied it. Now it is not highly infectious. You can do the postmortems. Yes, right now there are so many in all the hospitals of the world with the forensic, where postmortems are done in the entire world. Their tissue blocks, COVID lungs, have been kept preserved for future use, for research, for study purposes, for researchers, to make medicines in the case maybe you get another pandemic in the next maybe 50 years or 100 years. Doctors who will be there in case maybe COVID-19 happens to come back, maybe when it has slightly mutated, when it has maybe mutated totally, but retaining its genome with some mutations, maybe in the next 50 years, maybe in the next 100 years, doctors who will be there practicing, pathologists, will look at the part, will be looking at those lungs, the tissue blocks of that time, and they will compare. They will compare with the stored or the archived tissue blocks of COVID lungs. And they said, oh, between 2019 and 2022, or 2022 or 2023 or 2024, within those years, there was a global pandemic of COVID-19. And we are looking at the lungs, the histopathology of the lungs, the lung tissue blocks that we archived. We are now the same pattern. We are looking at it. Yes, this is COVID, which is back. COVID is back. Actually, these people are dying of COVID. And eventually, that by just comparing those tissue blocks, the pathologies of that time and the previous ones, they will be able to appreciate and say, oh, so people are dying. It is COVID that is back to that is terrorizing us again. Remember, there was a pandemic 50 years ago, 60 years ago, 100 years ago. Oh, now we know the solution. We are going to reverse now. We're going to start using in the treatment protocols of these patients. We are now going to introduce in this ABCD. With they also remember they have to add in the technologies of that time. Remember, so that is all that information We're able to get solutions because of postmortems. Dear members, dear brothers and sisters in the profession who are upcoming, we are able, in these days, we have cars that have those airbag technologies. How do you think they came to develop vehicles with airbags in them? Or that is, for example, you know those cars with the airbag technologies. The moment the car senses any potential impact, the airbags protrude from the dashboard. You fall. If you are the driver and all the people seated in the front, they are able to fall in those airbags. You hit the head there. The neck is protected. The trunk is protected, and part of the upper parts of the lower rims and the upper rims. You see, and the upper part. Please no. Don't interrupt. I'm coming. Sorry for the interruption. So, why do you do postmortems? Then eventually you find that the head, when you fall in those airbags, when they protrude in those microseconds or milliseconds, you just follow with it. You hit your head instead of hitting the head on the window screen. Then the dashboard, which is rocky hard. You end up falling in those airbags. You fall there, they cushion you, they protect your head, the neck, they protect the chest, the abdomen, the pelvic cavity, and eventually you survive, and at the end you are able to survive, or you sustain minor injuries which are not actually fatal. You see? So how did the motor vehicle manufacturing companies come up with that technology of producing airbags? Yes, worldwide, whenever the pathologists would be doing autopsies and postmortems on road traffic accident victims, they found out that, usually if the source of death following head injury, if the source of death following the road traffic accident involvement, if the death they found out the death they originate from brain injury or head injuries. If not head injury, it is cervical or neck injuries. If not cervical or neck injuries, from the thorax, the chest injuries, of the abdominal injuries, of the pelvic injuries. You see? That is then eventually they started giving their researches and findings, and they suggested ideas to the motor vehicle manufacturing companies that you people, if you started producing cars with the airbag technologies, whereby people can be so that in the case of any impact, any powerful impact, people can fall in those airbags, and can they survive? Yes, they found out they were able to survive, and they did tests, and eventually people started surviving. You see? So don't say from today onwards you should stop saying that it's useless to do autopsies. There are very many people who die suddenly. You find that they have died of heart attack. Others, of course, you find that they are poisoned. Then you find that the other party wants the body to be buried very, very quickly. But when you go to do the autopsy, you find that the cause of death maybe is poison, or the person had hypertension or high blood pressure that had not been diagnosed, and damaged the heart, damaged the kidneys, and the person died suddenly, or the person had maybe coronary artery disease or coronary heart disease, and which was silent and was not diagnosed, and eventually the person got a myocardial infarction or heart attack, which you call heart attack, myocardial infarction, also a cardiovascular accident, and died suddenly. And then people started saying, our person was poisoned, it is poison. When you go to do the autopsy, you find the heart was enlarged. You look at the coronary arteries, they are no longer even patent. You find the atheromatous plaques all over in those coronary arteries. Then you are able to take photos. You are able to even process histopathology samples. Then you rule out poison. You also even take blood samples to rule out poison or to confirm if there was really poison. You go for high performance liquid chromatography in those chemical pathology laboratories. You see? So then for you that it is not good to do an autopsy. It is very, very important. And it's not that we do, consent is not sought. Consent is sought from the relatives of the deceased. You don't just wake up and you just start doing postmortem on or the autopsy on some on the body of someone without the authority. No, you first actually you have to seek for consent from the relatives, from the immediate relatives. When they refuse postmortem or the autopsy to be done on their dear person, you don't do it. But of course, it is good to do it because you first, before you seek consent, you explain to them the reasons and the advantages of doing it. You convince them. If their culture or religion does not allow postmortems, autopsies, you don't do it against their will. Okay? So all those, ladies and gentlemen, yes, there are also other reasons, of course, like research for study purposes. Of course, we use death. To be a pathologist, you must appreciate that death occurs. You must first accept that death happens. And therefore, looking at a dead body should not be a big issue, or looking or doing an autopsy should not be a big issue. You must, first of all, you must, to make your heart strong, not to be faint-hearted, you must first appreciate that death is a natural phenomenon. Death occurs. Anything that is alive, that is biological, at some point must die. That is it. As long as it is not a forceful death, like murdering or killing, you know, as long as the person has died, maybe you have to accept that death at a certain point has to occur. And the body, remember, all the medicines that are discovered, all the medicines that we use to treat diseases, dear brothers and sisters, they were developed first of all, firstly by doing autopsies. Okay? Because, for example, when COVID was killing people massively, there are months when in 2020, when people were dying in Bergamo in Italy, they would, in Brazil, Italy, you know, there's a time when they would register like 80,000 deaths in 24 hours. What happened is this. In Italy, when people are dying massively in Bergamo, WHO had actually made a decree that, you know what, a directive that not doing a postmortems on COVID-19 patients. It is that COVID-19 patients are infectious. I mean, COVID-19 bodies are infectious. Therefore, you are going to again cause the disease to escalate. Then when Italians were dying, and the doctors, of course, were losing, of course, the various specialists were losing patients massive in various departments. They said, no, this is unacceptable. For how long? We need to know how the virus is damaging the organs so that we can understand, you can maybe reverse the treatment. I mean, you can maybe get new treatments for this disease and reduce on the mortality rate of our people. Then they convened an emergency meeting. The government of Italy convened an emergency meeting led by the Minister of Health, and they said, let all the pathologists who are below 50, those ones who are still younger, who are below 50 years, they should not participate in doing postmortems or autopsies. Then let those ones who are above 50 years and above start doing autopsies. So that this, if a 50-year-old dies, at least yes, it is a 50-year-old and above, because it was actually desperation. They were in a situation of desperation. They said, let the younger pathologists who are 50 years and below not participate. Those ones from 51 and above should take part in doing postmortems so that we know what is killing our people. They said, okay, for us, if we die, for us who are above 50, if we die, no problem. The young ones will remain grooming the generations to come. They said, okay, let us start. They started doing postmortems, autopsies in various actual regions and provinces of Italy. They did autopsies. Guess what? They found out, oh, the major cause of death was, yes, cytokine storm was contributing to most of the fatal pathologies among COVID-19 patients. Yes. Then they said, oh, they realized that cytokine storm would end up causing DIC, of course, causing microthrombi or blood clots in various organs of the body, and especially in the lungs. There would be acute respiratory failure, death. So they realized that, oh, death, the main source of death from our patients is due to formation of the microthrombi in the lungs and where? And that's why people are dying massively. They said, no, in the treatment protocols, what if we start using blood thinning drugs like warfarin, heparin, or even aspirin, and we add it, we also put it there in the treatment protocols so that we make blood more thin and we make it fail to overclot. So that instead of becoming thick and developing a tendency of clotting, forming clots, we rather give drugs which are going to make blood more thin, and we see whether our patients will keep on surviving, or we see whether the mortality rate will reduce. Indeed, when they started introducing anticoagulants among the treatment protocols, the death rates started reducing from COVID. That is how it started. That is how anticoagulants, blood thinners were introduced in the treatment protocols, and they revealed the information. Of course, they had gone against the ethics, against the directives of the World Health Organization. Sometimes that's why it is also good to break the rules. Of course, I'm not encouraging recklessness. I'm not encouraging criminality and that we start breaking the rules, you know. But sometimes it is also necessary to break some rules or to circumvent some rules, and you achieve something, as long as it is for the good of the nation, not for the bad of the people, for the bad of the nation or the world, you see. So by doing autopsies, they were able to find out the major, where the death were coming from, the immediate source of death, the immediate causes of death, and the absolute causes of death. They were able to find out. Of course, the other damages, which are multi-organ failure, were occurring, but again, mainly from formation of those blood clots, disseminated intravascular coagulation, of course, due to the cytokine storms and what. You should read about COVID pathology, COVID-19 pathophysiology or pathology, and you know what happened. At least now we have enough literature. So then there are also special indications of doing postmortems. For example, unexpected or unexplained death occurring during or following any dental, medical, surgical, diagnostic, or therapeutic procedure. Then also natural death that are ordinarily subject to forensic jurisdictions, like for example, after or following persons dead on arrival at the hospital, death occurring in the hospital within 24 hours after admission, death in which the patient sustained or apparently sustained an injury while hospitalized, death resulting from high-risk infections and contagious diseases. Of course, even in conditions like Ebola, postmortems up to now, of course, they can't be done. But in the near future, I'm sure we shall be doing postmortems so that we are able to understand the pathology of Ebola virus disease or Ebola virus or hemorrhagic fever. With time, with the technology, we are going to also start doing autopsies in the near future. I'm sure we shall also reach there. Of course, when we reach, we achieve the technology of protecting ourselves 100% from any possible infection while doing the autopsy. Then outside facilities with a special contract for autopsy coverage. All those are reasons as to why we do postmortems. Okay. Yes. Isn't pathology all about doing autopsies, stroke, postmortems? No, now you know it is not. I have already taken you through the branches of pathology. We already know it is not all about doing autopsies or postmortems. Why do you harvest organs from the bodies? We don't harvest organs from the bodies. We examine them and look for the pathologies, possible pathologies. What we do maybe, remember I said that we have as a must, we have to seek for consent from the relatives of the deceased. If they refuse, we don't go ahead, we don't do the postmortem, okay? You need to know this. Then in the process, we don't retain anyone's organ unless it's a special disease or a very rare disease, and you want to use it for research. Still, we go ahead before you retain that organ. We go ahead to engage the family, to engage the institution itself. For example, if it is Murago Hospital, we have to also to engage Murago Hospital. Then it also involves the institutional review board like that, the research ethics committee also. But of course, it must be something that is urgent. But it becomes an urgent actually consent so that they give us a go ahead. Otherwise, you don't just simply retain someone's organ for study purposes or for future researches without seeking consent. Okay. So what we do is to retain maybe some. If it is the brain, well, we keep samples from various maybe regions or lobes of the brain. We also sample the kidneys. We sample for study purposes, for research purposes. For research purposes, if we are suspecting maybe poisoning or toxicology, we take for sample from the liver for toxicology, kidneys for example from the kidneys for toxicology, result for toxicology studies, then contents from the gastrointestinal tract, then blood samples from also for all those for toxicology studies. You see, we only just keep just small samples, yes, small samples that are adequate for investigations, okay? But we don't retain the entire organ or like that, no. Then afterwards, we put back the body, the organs are put back into the body, and again, the body closed very, very in a respective fashion, in a professional fashion, and prepared for burial or for internment, or for any form of internment like that, or burial. So why do you harvest organs from the bodies? That is already, I have given you the reasons as to why we retain samples for future purpose, for future researches and studies, and also to teach the future generation of, for example, doctors and pathologists like that. For example, doctors who will be there in the next 40 years, pathologists will not be knowing COVID-19. They will not be knowing how, for example, COVID-19 kills, but it will be upon them to go and retrieve those archived tissue blocks from COVID-19 victims, and they study them like that. Then other diseases, like for example, measles. We know how measles kills, we know how death results from measles. So all those tissues are there, they are kept for generations to come. For centuries, they can even be archived for centuries, for example. So all those are uses. That's why we retain some of those organs. For example, there are rare conditions like genetic disorders whereby we can take even 20 years before getting a case. So in such conditions, when you get organs, a person who has died of such a disease, we're able to request for the seek consent and also keep those organs for further studies to teach the future generations of doctors, okay? And do like that. Are human organs like the brain used to make human medicines? You know, I have already explained this I have already explained this, please. There's no need to delay here. It is absolutely no, a big no in capital letters. Are you always scared of dead bodies and end up having bad dreams? No, by the time actually there's no need. I don't know why actually very many doctors fear to specialize in pathology. Because first of all, the first 2 years, while we are studying gross anatomy, microscopic anatomy, embryology, we are exposed to dead bodies. The first 2 years, you don't step in the hospital. You are in the laboratories. When you are as a medical student, and you are rotating in anatomy lab, dissecting anatomy laboratories, dissecting cadavers. Cadavers, those are preserved human bodies. Of course, you preserve the human bodies for studying anatomy, studying the structure of the human body, how the human body is built. The only difference is that maybe you find that cadavers are partially or semi-mummified. So we find the muscles are dry, bones are somehow dry. That's the only difference. For us, we deal maybe with the fresh bodies and all categories of bodies. That's the only difference. So actually, after doing even an autopsy, if I like eating meat, I will go even from there, from doing my work, I'll go and eat meat. There's no problem. It's like a garage. a motor vehicle garage, for example. When you go to a motor vehicle garage, and you find people, younger engineers, mechanical engineers who are training to become motor vehicle mechanics. For God's sake, you will not start repairing, you will not learn how to repair a vehicle by starting or beginning with that one, which is in a good mechanical condition. No, you begin with already engines, already gearboxes, already reverse systems like that, engine components, the body, the panel beaters. You begin with the already vehicles, the ones which are no longer in use. And then you eventually keep on upgrading, and you will start also repairing the normal vehicles which are still in good mechanical condition. Okay, likewise, that is it. Only that, of course, the body, I said when we are using these bodies for study purposes, we don't mutilate them. We treat them with respect. We handle them respectively. We handle them with respect, with the dignity. And afterwards, even when the study purposes are done, those bodies are buried like any other human being, not simply throwing away their bones, their tissues, no. They are buried in a dignified way. Or sometimes they are even cremated, depending, of course, on the protocols that are in place, like that. But they are buried in a special way afterwards. Then fresh bodies are brought, of course. Don't ask me how bodies are prepared. No. There used to be exchange programs. I don't know. We would get bodies from those bodies. Of course, bodies, when a body is not claimed for a certain time, usually 3 months, and maybe there are no owners, and the institution deems it for good for study purposes, they donate it to the medical school. But to avoid the havoc and problems, such bodies are taken to the farthest countries, and then they also pick those ones from those countries that are not claimed, and they bring them to our side, and we keep on exchanging like that. So that, to minimize on the incidences whereby you find your person who got lost, maybe you fail to locate him or her whereabouts, and you find a dead body, his body, and then you run away from the course, or you sue the institution for maybe having murdered your dear person, yet it is not the case. So to avoid such incidences, that's why exchange programs actually are still there, but they are still there. They are still actually done. But also, depending on the need for the cadavers for study purposes, you see, the institution can also prepare bodies locally, those ones their own, still those ones that have taken many months without being claimed. Okay, yeah. So we use death in simple terms here. We use death. We use death to treat the living ones, to treat the diseases of the living ones. So it is for the good of the death, that it is through death that we are able to understand how diseases kill and how to also treat them altogether. So it's not for the bad, but we study, a doctor should be trained on human bodies to understand. Remember, we are not trained out of the blue. You first choose a combination in A level, in high school, A level, advanced level, you choose a combination with biology, chemistry, physics, or mathematics. Then eventually you upgrade. Of course, in A level, you start by dissecting toads. They are hardening your heart slowly by slowly. Toads, you dissect rats, cockroaches, in biology practicals. Then you keep on advancing. They are preparing you for the worst. They are hardening your heart slowly by slowly. So that's why it is very rare to find a doctor when even if a dear person goes, yes, you accept, you feel the pain, that loss, but it's very rare to find a doctor crying. Because now, if you start crying as a doctor, what will the patients, what will the caretakers do? You are the source of hope. You are the one to strengthen them, that death is natural, it must occur. You are the one to prepare their minds for the worst, for any circumstance. Now, that's why you see doctors don't rarely cry, they rarely shed tears when they have lost people. Because you are the one to give the ones who are suffering hope, to strengthen them in such a scenario. Okay? So that's why they groom you indirectly, but they start training you to harden your heart. That's why, for example, a medical doctor like me, when I'm on the ward, or in the mortuary or in any laboratory, I'll not detect any strong smell, even if it is a bad smell. But a lay person who is not who is a non-medic will just, as soon as he or she enters the hospital, will detect it that this is a hospital environment. But me, my nostrils are almost insensitive to that smell. Or I may detect it, but it's not strong. For me, it is not too strong because I'm used. So we don't experience those bad dreams. Maybe for the beginners, maybe when you are just joining medical school, no, not really. Maybe it can happen, but me, I have never experienced any bad dream about that. I have to be honest with you. Don't you encounter spirits of the dead, the ghosts in the mortuaries? I have never. I have even never left the mortuary at 9 p.m. 10 p.m. Honestly, of course, we don't do postmortems in the night, but depending on, we have always been near the mortuary at least, even beyond the weird, actually, even during the weird hours, late hours in the night. But I have never seen any spirit. But people say that, for example, where there was a hospital and it was about, I have heard and also seen investigations somewhere on certain channels and also in certain papers that places that previously were being, that have buildings that were previously used as hospitals, as prisons, as prisons, or places where they bury people. I hear that the spirits, there are abnormal activities, paranormal activities which keep on occurring, taking place in certain buildings, especially that were used communally, as hospitals, the hospitals, prisons, like that. That one, it is a point, it is for you to research. For us, we deal with the bodies, we don't deal with the spirit or the spirituality, the spiritual aspect, we don't deal with it. For us, we deal with the bodies, okay? So I'm not right to you that I have encountered any spirit. Maybe those things happen. Anyway, for further information, you can read and research. You can go to Google for that. In that aspect, you can read about the Institute of Perceptual Studies, University of California Institute of Perceptual Studies. It is under Department of Psychiatry, but is now an independent institute under the that came from, that was born from the Department of Psychiatry, University of California Institute of University of Virginia Institute of Perceptual Studies. That's where they talk about those things that the sorrow, the spirit out of the body, what. But those, for us pathologists, we deal with the body. Other things I don't know. And I have never seen any spirit, anything to do with that. And neither have I have never had any pathologist who was attacked, or any mortuary professional who was attacked by any spirit. Just like the way you go to the garage and you see all of the motor vehicles, dead engines, what. That's the way we look at the bodies. We appreciate that death occurs and it is a natural thing, it is a natural phenomenon. So of all the other disciplines, stroke or specialties, what inspired you to choose pathology? Everyone has me as I will talk as an individual, as Dr. Amani Rachiza Robert, that I opted for pathology because I like studying and understanding diseases from the molecular level, from the cellular level to the tissue level, like that. That is what prompted me to go to opt for pathology. Then besides that, you must also, pathology gives you actually a lot of information. You appreciate using with your eyes, with the microscope, with the molecules. You appreciate what the disease is and what the disease does to the body. And through that, you're also able to come up with ideas of how on how you can reverse certain diseases through pathology. You can also add on knowledge on pathology, and you come up with you learn how to develop vaccines, how to develop new medicines or novel medicines like that, because you understood the disease, you understand and study diseases from the first principles. So if you understand diseases from the first principles, it means you are able to come up with the solutions, the potential solutions as well. For example, pathologists who are in Uganda Cancer Institute, they keep on actually researching on so many molecules that will be used as painkillers, that will be used as anti-cancer drugs themselves, just pathologists. So through that, that was my passion. Besides that, pathology is a discipline which is familiar by very few people. It is not a discipline of every Tom and Dick and Harry. So you must also be strong, you must also be sharp in a certain way to become a pathologist. Otherwise, that's why I say that is not for the faint-hearted. You must first of all appreciate diseases, you must appreciate that death occurs, okay? And also you must be someone who is a reader. You always motivated to read, because all the specialties are hard, they are unique and special in their own way, but to be a pathologist, you must be someone who is always self-motivated when it comes to reading anything. It's not that you grasp this, maybe this type of cancer, and say that I'm done, I'll never read again. No way, no way. You must always read more than any other doctor. Yes, even other doctors are always reading serious. Other doctors to PhD level, to fellowship level, those serious ones are always reading and reading. But a pathologist must read an extra mile more than the colleagues. For example, you might think that pathology is a simple discipline. It is not an easy discipline, and it is a very, very sensitive discipline. For example, if I get something that is maybe cancerous on someone's leg, and I say that something that is swelling or an abnormal growth on someone's leg or foot, and I call it a cancer when it is not a cancer, and I mess up as a pathologist. Maybe I try to be clever, I try to be a wiseacre, and I refuse to seek the second or the third opinion from my colleagues. And they say to me, I know it all. Let me make this final report and I hand it in. The surgeon is going to, the orthopedic surgeon or the general surgeon is going to receive, or the medical officer is going to receive that report very, very quickly from histopathology, signed and stamped by me, signed out carelessly without consulting my colleagues. And I remember it is something that is benign, but me, I called it a cancer. The surgeon is going to act quickly, amputate. Amputation is removal of the leg, cutting off the leg, surgical removal of the leg. You see? Then when they go for the second opinion, they find out it was not a cancer, but me, I carelessly called it a cancer. You see now, I hope you can see the weight of a pathologist. Or someone maybe comes with a breast swelling or a breast mass, something that is abnormal in a female. A woman comes to me with something that is abnormal in the breast that has not been there. Maybe it is something benign. I call it a fibroadenoma. I call it invasive ductal carcinoma of the breast, which is a cancer. Remember, it is a fibroadenoma, which is not, yes, it is good to be suspicious, but even then, you need to go ahead and seek, if you are not sure, as a pathologist or as a senior house officer or a trainee, you should still go ahead. There's no harm. There's no harm. Even a professor of pathology will tell you that my son, my daughter, where you are not sure, you should always seek for the second or third opinion from your colleagues before you mess up someone's life. Therefore, a fibroadenoma, you go ahead and call it a cancer, invasive ductal carcinoma of the breast, even go ahead to stage it, what. Then the surgeon, the surgical oncologist or the surgeon will receive that report, and will act quickly. Let me remove the breast or both breasts, radical mastectomy. Then they go to seek for the second opinion. They find that there's no cancer. It was just a fibroadenoma. As a pathologist, then you say that a pathologist is just a simple discipline. It is even a useless discipline. Oh, for us, we are the chiefs. We are always in the background, but we do wonders. We are the people who give good news and the bad news. But we did that news, good news or bad news, is delivered through your doctors who are treating you, are managing you. But for us, we are the chiefs in the background. So, you call something that is cancerous, you call it cancerous, you call it benign. And someone says, oh, dad, mom, the doctors have declared that I'm cancer. I don't have any cancer. The other thing is not a cancer. Then they throw a party, they slaughter the whole cow. They buy drinks, wines, celebrate the no breast cancer. They have found no breast cancer in me, no stomach cancer in me. Then after 1 year, the patient who was celebrating, the person who celebrated a year ago, that he or she did not have any cancer, if it was a breast or if it was a stomach, then eventually he starts again falling sick. By the time they go to go the hospital again, they start a journey. They do CT scan, they do what X-rays, they find chest X-rays investigation, they find even the cancer has grown metastasized, invaded distant organs. Oh my God. You see, as a pathologist, the harm that you have caused the death of that person, that patient. So pathology is not a discipline of everyone. Yes, people say that I can't do pathology because it involves doing postmortems. I hate dead bodies. Yeah, that is not the reason. The discipline is broad and very broad, very, very wide. The discipline requires you to be a reader. You should always bury yourself in books, whether you want it or not. Then the aspect of doing postmortems is just like 2 or 3%. No, that's not the reason. The discipline is very broad. Again, it's right, also somehow hard. It is somehow hard if you take it light and you say, hey, I'm going to study pathology because it is all about doing postmortems. Then I get my enough time, I go to chill. My dear brother, my dear sister, watch out. My dear junior colleague in the profession, watch out. You, the upcoming doctors and the nurses, dental surgeons, watch out, please. Watch out, watch out, watch out, watch out. Be very, very careful. It's not about doing what? It's not about that. A pathology is a sensitive discipline. A pathologist can make you to die or to live. So I have given you those scenarios. So you must have a keen eye. You must always read. You must always consult. You must always be there to learn new things all the time. So, like I said, it is not about to showbiz, pride. Each and every discipline is special in its own way. So that is also how pathology is unique. And yes, worldwide, there are very few pathologists because of those reasons. There are very many people who do not want to read, to overread. There are very many people who hate the microscope. There are very many people who hate things to do with the molecules. And me, those are my things. And always want to unravel and discover the unknown at least. And maybe discover the possible solutions to the problems that we encounter together as the world. So we hear that pathologists are drunkards, smokers, and end up with mental illnesses because of seeing dead bodies all the time. How true is this? This is not true because personally, I will tell you that I take some alcohol. I'm not a drunkard. Even before joining the medical field, I was taking my alcohol in moderation. And ever since I even traversed through medical school, clinical school, medical school, then to MMed pathology, my drinking pattern has never changed. Actually, these days, I even don't have enough time to go to the bar. I can even take 2 weeks minus stepping in the bar. And yet I do those things. I do postmortems, I do autopsies, I participate in the department, in the hospital, in all the hospital departments where we do those procedures from. I have never increased my drinking habit. It has remained constant. Actually, these days I no longer even, I can take 2 weeks, 3 weeks minus going to any bar. So that those are just individual characteristics. Those are individual characteristics. And I have even seen our professors, our senior consultants in the field who are always doing the autopsies. They don't drink, actually. Even the heads themselves don't drink, at least I know. They don't drink. Maybe once in a while they take wines, just those wines. Once in a while, but drinking, no. This is an individual thing. It is an individual thing. It is an individual character, not it is not shouldn't be attributed to this. Yes, the previous generation of pathologists used to overdrink alcohol. Maybe partly because of that, I cannot also rule it out. But me, my mindset and my character is that I have never changed my drinking pattern. Yes, and you commonly forced by the state or other entities to write autopsy reports in their favor. Yes, some of these situations occur. I will not refute them. I will not reject them. They occur. But also, if you are a pathologist, we are advised and trained by our seniors and guided properly. I will say that we are groomed very, very well. And we are told also the truth that these scenarios occur. We find that a certain prominent family can compromise you to make a report in their favor. Also the state itself. But again, in such political cases, you should not. We don't do those autopsies alone. No, we do such autopsies involving the state, involving politicians, involving stronger families, what, to avoid being compromised, and also to make you to be safe. Because a pathologist is like a judge, is like a constitutional judge who is going to preside over, maybe to determine whether there should be a rerun of the presidential race or there shouldn't be a rerun. So the way you see such judges being protected under heavy security, when they are going to make the final judgment, whether they should be a rerun or not, it's the same way such a pathologist is protected, and he or she should protect him or herself like that way. That's why in such cases whereby you are going to do such sensitive autopsies, you don't go alone. You do in the group, you go as a big group, as a group of 4 pathologists or 5, and you also leave room for the second opinion. So that in the event whereby that family that has lost a dear one, and it is a sensitive case, whether at any point when they seek for the second opinion from independent pathologists from other countries, so that you leave that gap so that an autopsy can be repeated by other independent pathologists, so that they are able to come up with the uniform findings without any influence, okay? So, but in such cases of whereby pathologists are compromised, yes, they are there. They are there, and you should be aware, and we should call a spade a spade. They are there. But in such cases, if you know that you are going to be compromised, don't do such a case alone. We have always been warned and advised over and over again. Therefore, we know what to do. Such cases, we are always a group. So at this point, dear brothers and sisters, allow me to declare the end of this session, part 2. Thank you for watching, and thank you for attending. We shall be linking up in the next chapter that I'll be sharing about pathology and also other things related to medicine. Thank you. Bye-bye. Thank you very much. Thank you very much. We shall keep on interacting in as far as the pathology as a discipline is concerned. And we are always available to share with you and to demystify information actually which is mutated, to suit actually the narrative like that. So I'm there, and an upcoming one, God willing, of course, I'm going to be in that league. But I'll keep on sharing with you information, general information about medical disciplines and also pathology. Thank you very much. Have a nice time. May God keep on blessing each one of us like that forever and ever.